If you are over 40, your spine may be aging faster than you think. Even if you don't feel any pain yet, many hours sitting, poor posture, and lack of movement will gradually make your spine stiff, compressed, and less flexible. It is something that happens silently, but it directly impacts your mobility and even the quality of your sleep. The good news is that you don't need intense workouts or expensive therapies to reverse this process. In this video, you'll discover 3 simple movements that help keep your spine young, flexible, and pain-free, improving your posture, sleep, and even your daily mood. Stay with me until the end, because these gentle stretches can make a huge difference in how your back feels. Tomorrow morning, Exercise 1, Cat-Cow Mobilization, adapted for people over 40. This is a classic yoga movement that helps mobilize the spine, relieve tension, and improve posture. Perfect for those over 40 who are beginning to feel stiffness in their back or neck. Adapted cat-cow mobilization. It is a controlled sequence of flexion and extension of the spine, which promotes segmental mobility and tension relief. How to do it. Step by step. Start on all fours, hands aligned under the shoulders, and knees aligned under the hips. Keep your fingers open, supporting the palm of your hand. Look at the floor, keeping your neck neutral at first. Inhale deeply through your nose and, as you inhale, let your belly slowly descend toward the floor, arching your lower back and lifting your chest. This is the cow movement. As you exhale through your mouth, pull your navel toward your spine, round your back as if you were pushing the ceiling with your spine, and bring your chin toward your chest. This is the cat movement. Perform the cycle with smooth, controlled movements. Suggested rhythm: 6 to 8 slow cycles, with each phase lasting 3 to 4 seconds. If you prefer, do 2 sets of 8 repetitions, always with coordinated breathing. Important technical tips: move slowly and with intention. Mobilization should occur in each segment of the spine. Do not strain the lower back. Imagine that your spine is unrolling, vertebra by vertebra. Keep your shoulders relaxed and don't hold your breath. Your breathing guides the movement. If you feel instability in your wrists, rest your wrists on a folded mat, or do the variation with your forearms supported. If you feel sharp pain at any time, stop and adjust the range of motion. Why this movement works. Over the years, the spine tends to lose segmental mobility, and the muscles that support the spine can become more tense or weakened. The cat-cow sequence promotes mobility in all regions of the spine: lumbar, thoracic, and cervical, helping to better distribute tension and reduce compression points between the vertebrae. By alternating flexion and extension, you also activate local circulation, improve the supply of nutritional fluid to the intervertebral discs, and stimulate proprioceptive receptors, which help re-educate posture. Coordination with active breathing activates the parasympathetic nervous system during the relaxing stretching phase, contributing to reduced tension and better preparation for sleep. Variations for beginners and adaptations. If you experience discomfort in your wrists, do the variation by resting your forearms on the floor, keeping your torso elevated above them. For those with acute lower back pain, reduce the range of motion. Work only small movements of thoracic mobilization. Smoother movement between the chest and shoulders, without straining the lower back. For those with stiff knees, place a softer mat or cushion under the knees. Another adaptation is to perform the exercise lying on your side, making small passive rotations of the torso. If the movement on all fours is uncomfortable, common mistakes and how to avoid them: making quick, sudden movements without coordinating your breathing, forcing yourself beyond your comfort zone, especially in the lower back, letting your shoulders rise toward your ears. This reduces the relaxing effect. Compensating with hip movements instead of spine movements. Avoid holding your breath. Your breathing guides the rhythm. Contraindications and precautions: do not perform this exercise if you have undiagnosed acute lumbar or cervical pain, if you have a history of symptomatic disc herniation, vertebral instability, advanced osteoporosis, or recent spinal surgery. Consult a doctor or physical therapist first. If you have severe hypertension, avoid holding your breath during the phases. Stop if you feel tingling, sudden weakness, or severe pain. How to integrate it into your routine and expected results: perform the cat-cow stretch when you wake up as part of your morning warm-up, and again at night before bed to promote relaxation. Performed daily for 2 to 3 weeks. This movement tends to increase the feeling of mobility, reduce morning stiffness, and improve sleep quality by reducing muscle tension. Combine it with the other 2 movements in the video for a greater cumulative effect. Exercise 2. Glute bridge. Exercise name. Glute bridge, one of the most complete movements for strengthening the lower back, stabilizing the pelvis, and improving spinal support. How to do it. Step by step, lie on your back on a mat or firm rug. Keep your knees bent and your feet flat on the floor, hip width apart. Your arms should be extended at your sides, palms facing down. 1. Take a deep breath. 2. As you exhale, press your heels into the floor and slowly raise your hips until your shoulders, hips, and knees form a straight line. 3. Keep your abdomen firm and avoid arching your lower back too much. 4. Hold at the highest point for 2 to 3 seconds, contracting your glutes well. 5. Inhale again and lower your hips in a controlled manner, vertebra by vertebra, until they touch the floor. Do 10 to 12 slow, controlled repetitions. If you want, repeat 2 sets with a 30-second break between them. Important tips. The movement should be smooth, without momentum. Keep your neck and shoulders relaxed on the floor. Imagine that you are pushing the floor with your feet. This helps to activate your glutes and hamstrings in a balanced way. The strength should come from the glutes, not the lower back. Why it works. The glute bridge is essential for people over 40 because it strengthens the muscles that support the base of the spine, glutes, hamstrings, and lower back. Over time, weakening these muscles is a leading cause of lower back pain and poor posture. This exercise also stimulates circulation in the pelvic and lower back, which helps reduce stiffness and the feeling of heavy legs. It also improves pelvic stability, preventing misalignments that contribute to chronic pain. Beginner variations. If you feel discomfort when lifting your hips, lift only partially until you feel slight activation in your glutes. To facilitate control, place a small pillow under your lower back at first, just to feel the support and not overextend the range of motion. Progression. Perform the movement with one leg at a time, doing a single leg bridge, keeping the other foot extended. Hold for 5 seconds at the highest point for greater glute and core activation. Use a resistance band around your knees to further activate the stabilizing muscles. Cautions and contraindications. Avoid this exercise if you have severe lower back pain, an active herniated disc, or recent surgery in the pelvic region or spine. Those with hypertension should avoid holding their breath. Breathe continuously. If you experience knee discomfort, adjust the distance between your feet and your body. How to integrate it into your routine. The glute bridge can be done in the morning to activate the muscles before the day's activities, or at night to relieve accumulated lower back tension. With daily practice, there is a noticeable improvement in posture, greater spinal stability, and a reduction in the feeling of heaviness in the lower back and legs. Exercise 3. Gentle spinal stretch. Exercise name. Gentle spinal stretch, a simple but extremely effective movement for releasing tension in the lower back, improving spinal mobility, and stimulating circulation in the lower body. How to do it. Step by step. 1. Lie on your back on a firm, comfortable surface, such as a yoga mat. 2. Extend your arms out to the sides, forming a T with your body. 3. Bend your right knee and slowly bring it over your left leg, rotating your hips. 4. Keep your shoulders relaxed and flat on the floor. The movement comes only from the waist down. 5. Turn your head gently to the side opposite the bent leg, if possible. 6. Breathe deeply and hold the position for 20 to 30 seconds. 7. Slowly return and repeat the same movement on the other side. Repeat twice on each side. Important tips. Don't force the movement. Go only as far as you feel a slight stretch without pain. Keep breathing slow and deep. It helps release muscle tension. If your knee doesn't touch the floor, place a pillow or folded towel for support. The key is consistency, not intensity. Why it works. As we age, especially after 40, spinal mobility tends to decrease, and the vertebrae lose some of their natural flexibility. Spinal stretching helps keep the paravertebral muscles, those that support the spine, loose and oxygenated. It also improves circulation around the lower back and abdominal region, areas often affected by stiffness and accumulated tension. This movement also indirectly acts on the nervous system, helping the body relax and reduce stress, which promotes more restful sleep. It is especially beneficial when performed at night, before bed, as it promotes a feeling of lightness and comfort in the back. Variations and progressions. For a more intense stretch, keep your knee bent closer to your chest before rotating. For greater comfort, keep a pillow under your shoulder or between your knees. If you just want to relax, keep the movement small and gentle, focusing on your breathing. Precautions. Avoid sudden movements. If you have a herniated disc, acute sciatica, or lower back inflammation, consult a physical therapist before performing this exercise. The movement should bring relief, not pain. Main benefits: reduces stiffness in the lower back and hips, improves posture and spinal alignment, stimulates blood circulation, promotes relaxation and relief from muscle tension, helps keep the spine young and flexible. At the end of the exercise, breathe deeply. Feel your spine lighter and your body more relaxed. With just a few minutes a day, you will be investing not only in the health of your spine, but also in your longevity and well-being. Taking care of your spine isn't just a matter of posture, it's a way to take care of your vitality. After age 40, our bodies change, supporting muscles weaken, and mobility begins to decline. But with just a few minutes a day, you can keep your spine youthful, flexible, and pain-free. These 3 simple movements have a powerful effect. They increase circulation, reduce stiffness, and improve the spine's natural alignment, which directly impacts your overall well-being. Most importantly, they help your body feel lighter, more energetic, and ready for daily tasks. Over time, consistent practice of these exercises can even improve your mood, sleep, and confidence. You begin to move more freely, and feelings of fatigue or back pain become increasingly rare. And if you want to maximize these results by combining a movement routine with nutrition that promotes longevity, good nutrition is essential to support the health of your joints, skin, and muscles. In the pinned comment, I left the link to Smoothie Diet, a program that helps balance the body from the inside out, with natural and practical recipes that support energy, weight control, and cellular health. It's worth checking out, especially if you want to feel lighter and more invigorated, as well as your spine. So, if this video was helpful to you, please like it, subscribe to the channel, and activate the notification bell. Here, you'll find weekly videos with simple and effective tips for aging with health, energy, and vitality. Take care of your spine, and it will take care of you. See you in the next video.